When someone we love is in their final 24 hours of life, it can be a very emotional and difficult time. You may feel scared, sad, or even unsure of what to do. It's important to remember that this is a natural part of life, and you are not alone. As the time gets closer, you might notice that your loved one is less awake or not responding when you talk to them. Their breathing may slow down or become uneven. They may not eat or drink anymore, and their hands or feet might feel colder than usual. These changes can feel scary, but they are normal signs that the body is preparing for the end. One of the best things you can do is simply be there. You don't have to find the perfect words to say. Holding their hand, playing their favorite music, or just sitting quietly by their side can bring comfort. Some people like to say loving words, share memories, or pray, while others prefer silence. There is no right or wrong way. Just being present is enough. It's also okay to take care of yourself. This is a hard time, and it's important to rest, eat, and ask for help when you need it. If you feel overwhelmed, reach out to a friend, family member, or a hospice worker for support. Hospice workers are there to help make this time as peaceful as possible. They include nurses, doctors, aides, social workers, and chaplains. Their job is to keep your loved one comfortable, answer your questions, and support you and your family. Even though a hospice nurse may not be there all the time, they will check in and make sure everything is going as smoothly as possible. They can teach you how to keep your loved one comfortable by adjusting pillows, giving small doses of medicine, or using soft music to create a calming space. Hospice care makes sure that a sick person does not feel pain and is as comfortable as possible. A team of trained people, like nurses, doctors, and counselors, work together to provide care. They also help family members understand what is happening and how to take care of their loved one. Hospice care can happen at home, in a special hospice center, or even in a hospital. The team will check in often, give medicine if needed, and answer any questions. They also give emotional support to help families feel less alone. Even though hospice care is very helpful, nurses and doctors do not stay with the patient all the time. Instead, they visit at certain times to make sure everything is okay. They teach family members what to do, like how to help with breathing problems or make their loved one more comfortable. If something happens or there is an emergency, families can call the hospice team for help. Nurses can come to the house when needed, and they are always available by phone. It can be hard to see a loved one go through this, and some people might feel like they are being left alone to handle everything. But hospice care is designed to support families, not leave them alone. If you feel overwhelmed, you can always talk to a hospice worker. They can give advice, comfort, and let you know what to expect. Other family members and friends can also help by sitting with the loved one, talking, or simply being there. No one has to go through this alone. Hospice is there to help make sure that both the sick person and their family feel supported, loved, and cared for. When a loved one is in their last day of life, their body starts to go through changes. These changes are normal and do not mean they are in pain. Understanding what happens can help family members feel more prepared. In the final hours, most people become unconscious. This means they are not awake and do not respond when you talk to them. Even though they may not open their eyes or talk, they can still hear. Speaking to them softly and holding their hand can be comforting. A person near the end of life does not feel hungry or thirsty anymore. Their body does not need food or water like before. Forcing them to eat or drink can make them uncomfortable. Instead, family members can keep their lips moist with a damp cloth or give small sips of water if needed. Sometimes a person's eyes may stay open even when they are not awake. Their mouth may also stay open because their muscles are too weak to keep it closed. This is normal and does not mean they are in distress. A soft cloth or pillow under the chin can help close the mouth gently. Breathing may slow down, become uneven, or stop for a few seconds before starting again. This can seem scary, but it is a natural part of the body shutting down. The person is not struggling or feeling pain. Family members can stay close, speak softly, and keep the room quiet to make them more comfortable. In the last hours, some people make a rattling sound when they breathe. This happens because saliva collects in the throat since they can no longer swallow. It may sound concerning, but it does not hurt them. Changing their position or using medicine can help reduce the sound. A person's skin may feel cold, and their hands and feet might turn blue or purple. This happens because blood is moving to the important parts of the body, like the heart and brain. Their skin may also look pale or blotchy. Keeping them covered with a light blanket can help them stay comfortable. These changes are a natural part of the dying process. Hospice caregivers and family members can provide comfort by being present, speaking calmly, and ensuring their loved one is peaceful in their final moments. When a person is in the final stage of life, their body starts to slow down. This is called the actively dying phase, which usually happens in the last few days or hours before death. Understanding the changes that occur can help family members prepare and provide comfort. The actively dying phase can last from a few hours to a few days. During this time, the person may sleep more and not respond when spoken to, have weak or no appetite, breathe slower or with long pauses, have cool hands and feet, show little to no movement. These are natural signs that the body is shutting down. As the body nears the end of life, it stops working the way it used to. The heart beats slower, digestion stops, and the brain uses less oxygen. This can cause confusion or restlessness, lower body temperature, changes in skin color, less need for food and water. Though these changes may seem worrying, they do not mean the person is in pain. In the final hours of life, a person may not be able to speak or move much, but they can still feel discomfort. Family members and caregivers can help by recognizing signs of pain, using medication for relief, and managing changes in breathing and body temperature. Since a dying person may not be able to say they are in pain, it is important to look for signs like facial expressions such as frowning or grimacing, moaning or groaning sounds, restlessness such as moving hands or feet frequently, tight or stiff muscles. If these signs appear, the person may need medication or adjustments to their position to make them more comfortable. As death nears, breathing may become slower, irregular, or include long pauses. It can be distressing to watch, but it is usually not painful. To help, keep the person's head slightly raised with pillows. Use a fan to provide fresh air. Offer medications prescribed by the hospice team to ease breathing. A death rattle is a gurgling sound that happens when saliva builds up in the throat. It may sound alarming, but it does not cause pain. To help manage this, gently turn the person's head to the side. Keep their mouth clean with a damp sponge or cloth. Use medication if prescribed to dry up extra secretions. A dying person may develop a fever or have cold bluish skin as their circulation slows. To provide comfort, use a cool, damp cloth to lower fever. Keep them covered with light blankets to prevent chills. Gently reposition them to avoid pressure sores. Providing care during this time helps ensure that the person remains as comfortable as possible. Staying calm, offering gentle touch, and speaking softly can provide emotional comfort as well. Anticipatory grief is the sadness you feel before your loved one has passed. It happens when you know death is near, and it can bring feelings of fear, guilt, or helplessness. To cope, talk about your feelings with a friend, family member, or hospice counselor. Write in a journal to express emotions you may struggle to say out loud. Allow yourself to cry, but also cherish the moments you still have with your loved one. It's okay to grieve before they are gone. It's a natural part of saying goodbye. You may feel like you need to be by your loved one's side every moment, but caregiving can be exhausting. To take care of yourself, take short breaks to eat, rest, or go for a walk. Accept help from others when it's offered. Remember that stepping away does not mean you love them any less. Being well rested allows you to be more present and provide better care. You don't have to do everything alone. Hospice teams, family, and friends can offer support. Ways to ask for help include assigning simple tasks to others, like bringing meals or sitting with your loved one, calling a hospice nurse with any medical concerns, reaching out to a counselor or spiritual advisor for emotional support. Lean on those around you. It's okay to ask for help. A calm and soothing space can bring comfort to both you and your loved one. To create a peaceful environment, keep lighting soft and noise levels low. Play gentle music or read aloud if they find it comforting. Surround them with familiar objects like family photos or a favorite blanket. These small touches can make the final moments feel more serene and filled with love. Caring for someone at the end of life is an emotional journey, but you are not alone. Taking care of yourself, seeking support, and creating a comforting space will help both you and your loved one find peace during this time. Saying goodbye to a loved one is one of the hardest things anyone can face. There is no perfect way to do it, only what feels right for you and them. Here are some simple ways to express love, respect, and comfort during this time. Many people worry about finding the right words, but what matters most is speaking from the heart. You don't need to say anything complicated. Simple phrases like, "I love you," "Thank you for everything," "I will always remember you." These words can bring peace and reassurance. If you're unsure what to say, just holding their hand and being present is enough. Everyone has their own way of saying goodbye. Some may want to talk openly about death, while others may prefer to focus on happy memories. Respect their wishes by listening to what they want to talk about, avoiding forcing conversations if they aren't ready, offering comfort in their preferred way, whether through words, touch, or just silent presence. Each goodbye is unique, and honoring their wishes makes the moment more meaningful. Grief looks different for everyone. Some cry, some stay quiet, and others find comfort in sharing stories or keeping busy. There is no right way to mourn. Accept that you may feel sadness, relief, guilt, or even numbness. All are normal. Others in your family may grieve differently, and that's okay. Healing takes time, and there's no set timeline for when you should feel better. Give yourself permission to grieve in your own way, and don't be afraid to seek support from loved ones or a counselor. Saying goodbye is never easy, but expressing love, honoring preferences, and allowing yourself to grieve will help you find peace in this difficult time. It is common for family members to have different ideas about how to care for a dying loved one. Some may want to do everything possible to extend life, while others may believe in focusing on comfort. Disagreements can arise over medical decisions and treatment options, how much pain medication should be given, who should be present during the final moments, handling finances, belongings, or funeral plans. To prevent conflicts from overwhelming the situation, keep the focus on your loved one's wishes. If they have shared their preferences through a will, advance directive, or previous conversations, honor those choices. Stay calm and listen. Everyone is grieving in their own way. Try to understand different viewpoints without anger or judgment. Choose your battles. Not every disagreement needs to be resolved immediately. Prioritize what truly affects your loved one's care and comfort. Take breaks if needed. If tensions rise, step away to clear your mind before returning to the discussion. Hospice teams are trained to handle family conflicts and provide guidance during difficult times. They can help by facilitating family meetings to ensure everyone's voice is heard, providing emotional support through social workers or chaplains, explaining medical care decisions in a way that reduces misunderstandings, helping to create a care plan that respects the patient's wishes while addressing family concerns. If disagreements become overwhelming, hospice professionals can act as neutral mediators to bring family members together. Their experience and knowledge can help keep the focus on love, respect, and peaceful caregiving. Family tensions are natural in times of loss, but with patience, understanding, and hospice support, it is possible to navigate these challenges with care and compassion. The final moments of a loved one's life can be emotional and overwhelming. Knowing what to expect can help ease fear and uncertainty, allowing family members to focus on providing comfort and saying goodbye with love and peace. Many caregivers worry about giving medication in the final hours, fearing they might cause harm. However, medications provided by hospice are meant to ease discomfort, not speed up death. They can help with pain, agitation, and breathing difficulties. To feel more confident, follow the instructions given by the hospice team. Remember that keeping your loved one comfortable is the top priority. Ask a nurse for guidance if you're unsure about dosage or timing. When your loved one takes their last breath, it is okay to take a moment to process what has happened. There is no need to rush. Here's what to do next. Check for signs of passing. Look for no breathing, no pulse, and relaxed facial muscles. Call the hospice nurse. They will confirm the death and guide you through the next steps. Spend time with your loved one. Many families choose to sit with the body for a while, saying their final goodbyes before the body is removed. Notify other family members. If others need to be informed, make calls when you feel ready. Follow any pre-arranged plans. If funeral arrangements were made ahead of time, follow the next steps as planned. The final moments can be difficult, but they can also be peaceful and full of love. Knowing what to expect and having support from hospice can help make this transition as gentle as possible. The last hours of a person's life can be a time to share special moments. Some families choose to hold hands, play soft music, or say words of love and gratitude. Others may sit in silence, offering comfort just by being present. Every family experiences this moment differently, and there is no right or wrong way to say goodbye. If possible, take time to share fond memories or express appreciation. Offer reassurance that it's okay to let go. Simply be there, even if no words are needed. Grief does not end when a loved one passes away. It is a journey that takes time, and support is available. Hospice teams often provide grief counseling and resources to help families adjust. Talking to friends, joining a support group, or seeking professional help can also be valuable ways to cope. Even though your loved one is no longer physically present, their memory and impact remain. Finding ways to honor them through stories, traditions, or personal reflections can bring comfort in the days ahead. You are not alone, and there is support to help you through this journey.